Hi there, we're going to talk about cancer today. This is not a pleasant topic, but it's very relevant to us, especially here in Delaware. As of 2014, we had the second highest rates of cancer in the U.S. So the only state that has higher cancer rates than Delaware is Kentucky. So we're not doing too good with cancer. So the odds of you taking care of somebody who has cancer are pretty good. So you need to know a little bit about it. First of all cancer is an abnormal growth of cells. So all of our cells regenerate over time. So cancer is just an abnormal growth of it. It didn't regenerate the way that it was supposed to. So that can cause a lot of problems, and it can cause pain. It can cause death even. So I'm sure we can all name several different types of cancer. Really, cancer can happen anywhere in the body, to any organ, and any body system, because it has to do with regeneration of cells. So I'm sure you know someone who's had one of these types of cancers yourself, or maybe you yourself have had cancer. So we're going to talk a little bit about these different types. It is the second leading cause of death in the United States, so it is pretty significant, and it's very, very common. There's a lot of different factors that play into why people get cancer. Here are some of them. So diet can be related to about 1/3 of cancers. So that's not good, right? And we know in the U.S. we don't have the best eating habits. We eat a lot of highly saturated fatty foods. We eat processed foods, things that have a lot of preservatives in them, and that's not good for us. So that can increase our risk of developing cancer later on, especially cancers of the digestive system, like rectal cancer, colon cancer. And then environmental factors like smoke and pollution, firsthand smoke, secondhand smoke, those can really increase our risk of developing these cancers. We know that one of the major risk factors for smoking is lung cancer. But it could also be throat cancer, and that can develop into other types of cancers. Smoking increases your risk for all types of cancers, because your body's constantly trying to regenerate itself because of all the damage that you're doing to it. So we have a lot of pollution in Delaware, which is probably why we have such high cancer rates. So those would be environmental factors. And it's not just pollution that's in the air, it's also pollution that's in the water and the ground, and then it gets into the food that we eat and the water that we drink. So we have a lot of that around here. And then infection, about 1/5 of cancers are directly related to infection. For example, H. pylori in the stomach can lead to stomach cancer, or ovarian cancer from STDs. So those would be examples of that. And then there are other factors that play into why we develop cancer. So some of them are modifiable risk factors, and some of them are not modifiable. Modifiable risk factor means that I can do something about my risk. I can change my lifestyle. I can do something differently. But non-modifiable, I can't really do anything about. So non-modifiable would be something like your age. You can't make yourself younger. We all try, and nothing's worked yet. So as we age, our risk for cancer increases. Genetics, you can't change your DNA makeup. So if cancer runs in your family, then your risk is higher. But then there are some things that we might be able to change, like radiation, exposure to radiation, or maybe exposure to certain chemicals. You can change the fact that you eat bad. You can try to exercise more. So there are all kinds of warning signs of cancer. And let me just preface this by saying you probably don't have cancer. So just because you see one of these things and say, oh, that's me, you probably don't have cancer. But if you notice these things, it does mean that you should get it checked out, because it's not considered normal. So any change in bowel or bladder habits, especially constipation, when that's not really been something that you've ever dealt with, and now suddenly you're constantly constipated, that could indicate an obstruction somewhere. Or not being able to urinate suddenly, that could indicate an obstruction. Sores that don't heal, especially like moles, they're just constantly breaking open. That's a bad sign. So that concerns us, makes us think maybe that there could be skin cancer. Any bleeding that's unusual needs to be investigated. Bleeding is not considered normal if you're not injured. So if we have a woman, for example, who's already gone through menopause and then suddenly starts to bleed vaginally again, then we worry that maybe there's cancer. Any thickening or lumps, especially lymph nodes that are growing when the person's not sick, that could be an indication of cancer. Indigestion or difficulty swallowing, sometimes people even complain of like having a lump in their throat. That puts us at concern for esophageal cancer. Any change in a wart or mole, so if it's getting larger, we like to say if it's bigger than the point of a pencil eraser, so if it's larger than that, then we need to be concerned about it, at least get it checked out. If the border is irregular, so if it's not perfectly round, if there are different colors in that mole, if it's flaking, or if it's breaking open, it's turning into a sore over and over and over again, we need to get that checked out. And then if the skin changes too, any change in the skin texture, integrity, that needs to be investigated because that's not considered normal. If somebody has a nagging or persistent cough for no reason, they're not sick, they're just constantly coughing, it needs to get checked out because that could be an indication of lung cancer. And then sudden unexplained weight loss. If you've just lost 30 pounds and you weren't trying to lose it, you haven't changed your diet, nothing in your lifestyle's changed, that's not a blessing. Something's probably not right. So it's not normal to be losing a lot of weight if you haven't tried. So we need to investigate that. So the key to preventing this is detection. The earlier we can detect it, then we can do something about it, prevent it from spreading. So once cancer has spread to other organs from where it started, that's called malignancy, then we really get concerned, and that's when mortality rates get higher. Okay, so we talked about this, things you can do. You can stop smoking, you can eat better, exercise, limit your exposure to secondhand smoke. All of those things will decrease your risk for developing cancer. So if you are taking care of somebody who has cancer and they're undergoing treatment for it, or even if they're not undergoing treatment for it, they have a few needs that we need to be aware of. So pain is going to be part of this. Maybe even if it's benign, meaning it's not dangerous necessarily, it's not spreading, it can still press on things and cause pain. So this person might have that tumor removed, or they might take medication, and those medications have side effects such as constipation, or it might make them very lethargic and sleepy, so they're going to be a fall risk, so be aware of those things. If somebody's on chemotherapy, it can cause nausea and vomiting. So all of the things that come along with chronic nausea and vomiting, so you have to watch their electrolytes, make sure they're drinking enough, that they're not becoming dehydrated. They start getting sores in their mouth, so they need good mouth care. Their risk for infection is going to increase because chemotherapy kills all your cells, even your white blood cells, so you don't really have an immune system anymore. So we need to be very careful if we're not feeling well, that we're not exposing them to something unnecessarily. Being their emotional support, sometimes just being, a crying shoulder or listening ear. And again, use your therapeutic communication skills. You don't need to tell them all about, well, my grandma had this, and this happened to my uncle, and blah, blah, blah. Just be a listening ear. We always need to talk less, listen more. Providing good skin care, especially if somebody's getting radiation, they might sometimes have burns from the radiation, so that's painful. They might have to get dressing changes to those burns, so be very, very careful. And of course, this is exhausting. This treatment wears you out, so be their assistance as much as possible. Okay, so that kind of concludes cancer care. Just don't be surprised because, like I said, in Delaware, we've got a lot of this going on, so I will see you guys later.